Welcome to Viruskenner. My name is Valerie. There are several well-known diseases that are being spread by mosquitoes. These tiny insects can be more dangerous than you could ever suspect. In this video we will discuss the questions: how are viruses transmitted through mosquitoes? Which viruses are usually being spread by mosquitoes? And how does this work? This time Viruskenner reporter Laura will help us to find the answers that we're looking for.
En weten jullie welke virussen in Suriname veel voorkomen?
De chikungunya.
Welke zijn?
Chikungunya virus.
AIDS.
Chikungunya ook.
Ja.
Chikungunya.
Malaria. Dengue.
Weet jij misschien hoe de chikungunya en dengue worden overgedragen?
Muskiet en een andere muskiet prikken.
En hoe denk je dat zich dan kan verspreiden? Op welke manieren gaat dat?
Een virus kan zich verspreiden door een muskiet. Het kan zich verspreiden door bloedcontact.
Hello Viruskenner, this is Laura from Wageningen. I'm standing in front of the Wageningen University and we're going to Sander Koenraad. He's an expert in mosquitoes.
There are many different viruses that can be transmitted by mosquitoes. You have Zika virus, chikungunya virus, dengue virus, many more viruses that can all be transmitted by mosquitoes via the bite of the mosquito.
Okay, and malaria, for example?
Malaria is not a virus, malaria is a parasite. But in a way, the mechanism by which it's transmitted to the next person, the next victim, is similar.
Okay, and how does the transmission work? What do the mosquito do?
So when the mosquito bites, it takes up some blood and it injects the saliva. And with that saliva, it also injects a little bit of proteins to make it easier to take up the blood. So they make your blood a little bit thinner. But in that same saliva, you can also have a virus that can cause disease.
Where does the mosquito get the virus from, actually?
The mosquito gets the virus from a sick person. So when it bites, it takes up a little bit of blood. And the virus is also in the blood. So the virus ends up in the stomach of the mosquito. And then it takes some time for the virus itself to develop, to reproduce, to produce more virus particles. And eventually, these virus particles end up in the salivary glands of the mosquito. So when the next person is bitten, a little bit of saliva is injected and the virus particles also enter the bloodstream of the next victim.
How does it work? Can all mosquitoes transmit the virus to people?
No, that's very interesting because there's only a limited number of mosquito species in the world that can actually transmit viruses. But for sure, not all mosquitoes.
Okay, and I heard something about the male and the female mosquitoes, that it's different.
It's indeed only the females that need blood. So only the females bite and can transmit viruses. And the females use the proteins from your blood to make eggs. So for the mosquitoes, it's really needed to reproduce. So what you see here is that these mosquitoes are getting a blood meal. So it's not us that are providing the blood, but we have an artificial system. And you can see that here. This is what we call a membrane feeder. We provide some blood here, and there's a small piece of parafilm, so plastic material over it. And we can place that. It's a bit warm. You can feel. It mimics skin temperature.
Oh yeah.
And then when we place it on top, the female mosquitoes that are in this cage, they will come and take some blood from this system. Now after that, when they've taken a full blood meal, they will rest and they will develop their eggs. That takes about 3-4 days, and then they lay their eggs in that small cup of water that you see in the cage. And what you see there, that there's these small rafts, and these are packages, small, of maybe 100 or 200 eggs that are glued together.
Wow, so many.
Yeah, that's like one female mosquito in one cycle can produce 100, 200 offspring easily. Yeah.
And how does the egg develop to a mosquito?
Well, that we can show here. Here are all these egg rafts that we place in the water because all the larvae develop in water. So the mosquitoes need water. They need to find a place to lay their eggs. And what you see here is that some of these have already hatched. Probably this morning or yesterday afternoon, they came out of their egg. They are insects and they take up food and they mold. They throw off their old skin 4 times to be able to grow. And then eventually they can become about this size. So if I tap this this tray. You see them wriggling around. This is what you can also see in your own backyard or in your own garden. If you have maybe a rain barrel or some other place where you have rainwater collected, you see these tiny wrigglers in the water.
So that's why you have to clean up all your waste.
If you throw away this water, it also throwing away the mosquitoes, and they cannot emerge from this breeding site. So you reduce the number of mosquitoes. So for sure, cleaning up your environment and throwing away the water definitely helps to reduce the numbers of mosquitoes around your house.
That's fascinating. It's such a sad thing that these tiny creatures can bring about terrible damage to our bodies. That's why it's absolutely necessary for us to prevent mosquitoes from spreading infectious diseases. But how? Laura and Sander already mentioned one way, by getting rid of standing water that contains the eggs or larvae of mosquitoes. But are there more ways to keep these insects away?
En hoe denken jullie dat je het beste virusinfecties kan voorkomen?
Zika-virusinfectie. Door je rommel op te ruimen, door in een
schoon omgeving te doen. Ja.
Dus de omgeving waarin je leeft, om die schoon te houden. En hoe kan je dan voorkomen dat je die ziektes krijgt?
Onder een kamboe te slapen, elke nacht een beetje bijgaan in je kamer te spuiten of mosquitokaars aan te maken.
Wat zouden jullie andere mensen aanraden om virusinfecties te voorkomen?
Wees voorzichtig waar je gaat of wat je doet. Of, wees voorbereid, vooral als je op vakantie of zo gaat. Volg de berichten goed, want zo kan je ook de plekken vermijden.
Gezond eten. Gezond eten is heel belangrijk. Ja, voorbereiden zoals je zegt op muskieten, klamboes. Dat soort dingen zijn heel belangrijk. Lotions.
Ja.
Dus preventie is eigenlijk heel belangrijk, zeggen jullie?
Het begint allemaal bij preventie.
Ja, dat ze zeggen, voorkomen is beter dan genezen. Toch? Dus,
En kennen jullie het zieken? Ja. Hebben jullie dat zelf doorgemaakt?
Chikungunya had mijn vader wel, maar ik heb het nooit gehad. Ja.
En denken jullie dat Zika nog steeds in Suriname heerst?
Ik denk het hoor. Ja, ik denk het. Ja.
En wat voor symptomen krijg je daarvan?
Symptomen.
Je krijgt pijn in je botten.
Hoofdpijn, rugspijn, misselijkheid, je ogen draaien soms ook als je die ziekte daar hebt, duizeligheid.
Heb je zelf ooit een virusinfectie doorgemaakt?
Jawel, denguevirus.
Okay. En hoe was dat?
Niet prettig. Ja.
Wat voelde je?
Lichaamspijnen, gewrichtspijnen, ja. Helemaal zwak. En het enige is uitzieken.
Ja.
Alleen paracetamol, je kan er niets aan doen. Goed eten, that's all.
How can we recognize such a virus? For example, dengue?
Viruskenner. This is Leonie from Erlangga University, Surabaya, Indonesia. That is a really good question, Valerie. Let's see if we can find an answer to your question here. Dr. Bimal is a resident at the Dr. Sutoma Hospital in Surabaya. He will explain to us how we treat diseases transmitted by mosquitoes, such as dengue.
If you yourself got infection, or maybe you know someone that got infection of the dengue fever, you need to take action is treating a lot. And of course, you need to go to the physician or hospital soon enough. In your home, you can get a fever drug if you get fever. Drink a lot to maintain your hydrate condition. After you get to the hospital or someone you know got a dengue fever, got a hospital, doctor will treat you by infuse to your vein so you can get fluid therapy there.
And when would you recommend for someone to go to the hospital? Are there any specific symptoms or any specific degree of disease?
Yeah, the symptoms is like high fever. Yeah, high fever on the first day or earlier day, and also you can get a rash. You can get a joint pain, not feeling well. Sometimes it's like a flu-like syndrome. Maybe sometimes it's difficult to differentiate it, just common flu or dengue fever. That's why if you got a high fever, a joint pain, a rash, or rhinorrhea, a blood rhinorrhea, maybe that's a sign of symptom of the dengue fever. That's why if you found the symptoms, you need to go to doctor or to the hospital soon enough.
Thank you, Laura and Leonie. So, this type of transmission occurs in many countries, especially countries with a warmer climate. And it is important to prevent mosquitoes from biting us. Now let's spread the right information to create more awareness.